Okay, hello everyone, and thank you for tuning into my videos. I have been getting more and more views lately. Much appreciated. If you're willing to share stories, information, maybe other things you come across, please feel free to comment below. I'm actually looking forward to my first comment. Anyway, so today I'm just going to be reading off of a website that states 54 facts about heart disease. And this is to continue with Heart Awareness Month, which is still going on. I do apologize for not posting any new videos for the last few days. I have actually been quite busy and in some circumstances unable to actually post a video, make it, much less post it. But today I'm going to do a slightly longer video in order to try to make up for that with the facts. I will, of course, post the website for this down below in the description if you'd like to check it out for yourself. At the top of it, it has a video stating 10 startling facts about heart disease. So, might be worth checking out. But I'm going to start out with the list that it gives. So, number one, heart disease is the number one cause of death for both men and women in the United States. Cancer and stroke round out the top three. Heart disease, number two, heart disease is an umbrella term that includes conditions such as cardio artery disease, heart attack, cardiac arrest, congestive heart failure, and congenital heart disease, among probably many others. The most common cause of heart disease is cardio artery disease, CAD, which is a blocked or narrowed cardia artery that supplies the heart with blood. Number four, heart disease accounts for 40% of all U.S. deaths, more than all forms of cancer combined. More than all. Wow. That is actually quite a saying. Heart disease costs the United States $360.4 billion annually. Good reason to start trying on your heart prevention if you don't have it. 6. This one talks about some of the drugs. So I'm going to skip down. I don't want to give anyone any ideas drug-wise on this stuff. So, it's one of those things. Do talk to your doctor if you think you actually do have a medical condition. But, yeah. So number 7, a person with both a first-degree relative, a parent or sibling, a second-degree relative, uncle or grandparent who suffer from heart disease before the age of 60 is nearly 10 times more likely to suffer from heart disease early in life. Very true. This is why you have to be very, very careful. Aunts, uncles, grandmothers, just about anything, any relative that's within first and second degree that you can think of. CT scans of mummies, murmurs, rival that heart disease was surprisingly frequent in ancient Egypt, suggesting that heart disease is caused by factors other than modern habits, such as smoking, fast food, and TV watching, inactively, of course. A Dutch study claims that men and women with eyes that measure less than 23.62 inches, 60 centimeters, in circumference have a higher risk of developing heart disease. Well, something to think about. Number 10, it takes just 4 to 6 minutes after cardiac arrest before a person experiences brain death and then complete death. The survival rate outside a hospital is less than 1 to 2%. Ooh. So yeah, really, really learn to call 911 if you think someone's having a cardiac arrest situation. Number 11, 16% of patients treated in Seattle for cardiac arrest survived, compared to 3% in Alabama. Ooh, that's something I didn't know. And sorry, the dog has been barking a lot today, so you're going to probably hear that in the video. Researchers should suggest that those who stay up late may be more prone to heart disease even if they get 8 hours of sleep. Also, in one study, women who slept 5 hours or less a night were 39% more likely to develop heart disease than women who got 8 hours. All of this is possible due to habits or even associated with late nights or short sleep hours rather than the time factors themselves. Number 13, heart attacks and sudden cardiac arrest are two different events. A heart attack occurs when blood supplies to the heart muscle stops and the heart muscle dies. A sudden cardiac arrest, SCA, occurs when the heart suddenly stops pumping due to an electrical problem in the heart. And a SCA, may occur in tandem with a heart attack. Number 14, in the United States, more than 1,000 people die every day from sudden cardiac death or cardiac arrest. People who live are twice as likely to have a heart attack or sudden cardiac death as those who live with a partner or roommate. Oh, those who live alone are twice as likely. Laughing relaxes and expands blood vessels, which help protect the heart. So even one more reason in life to actually laugh, people. A little fact on laughing, though, just for those of you who didn't know, kids laugh about 100 times a day, whereas adults usually laugh about less than half of that. So try to get in your laughs whenever you can. Number 17, negative emotions and depression are risk factors for heart attack and stroke. Conservatively, happier people are less likely to develop heart disease. So this is a reason that even if you're feeling down or depressed or something, try to find good in life. Try to find reasons to be happy or to feel happier. Life isn't all a bad thing. Number 18, researchers found that a woman's resting pulse rate was a good indicator of her risk of a heart attack. Women with high heart rates at or above 76 beats per minute were more likely to suffer a heart attack than women with lower resting pulse rate, 62 beats per minute or less. So, yeah, that's actually something to consider. Number 19, 6.5 million Americans suffer from severe cardiac pain. There's a medical term here, but I'm not too sure how to pronounce it, but yeah. Number 20, more than 2,500 Americans die from heart disease each day, equaling one death every 34 seconds. Ooh. So in almost a 2-minute period of time, we have up to 2 people dying from heart disease. So that's just how big this is. 21, age is the most significant risk factor of developing heart disease, followed by gender, family history, coupled with ethnicity, background, smoking, obesity, lack of exercise, high blood pressure, diabetes, and high blood cholesterol. Long list there. I highly suggest anyone who's more curious to go ahead and check out number 21 on this, because those are things that you really should actually start looking into in order to try to determine what, one, your risk factor is, and two, what lifestyle choices you might need to start making in order to up your chances of not having a heart disease problem of some sort. 22, approximately 40% of people having a heart attack die before they get to the hospital. Oh, that is not a nice number to see, but it's just that much more reason to take good care of your heart. A good, strong heart has a better chance of survival, yes, a not more guaranteed chance, just a better chance. 23, heart drugs may have serious interactions with herbal supplements such as, St. John's wort and garlic. So, yeah, you got to be careful about that. Don't get me wrong, herbal supplements can be a wonderful thing for the body, especially for some people whose body might be able to function better with an herbal supplement than with actual medication at times. 24, in 2006, heart disease death rates were highest in Mississippi and the lowest in Minnesota. Ooh, nice. I'm just going to read the next two, and, that's going to be it for the readings. 25, menopause women are at a higher risk for developing heart disease because their bodies produce less estrogen. Oh, that's something that I didn't know. So yeah, menopausal situations actually apparently play a factor outside of course, a factor that most women already know: giving birth or getting pregnant. 26. A strategical study in Wales found that having an orgasm at least 3 times a week may decrease the risk of a man dying from cardio heart disease by half. Okay, so interesting fact for you men out there. I did not know I was going to come across that one. But as I said, the website for this for today's reading is going to be down below in the description. So if you'd like to check it out, read the rest of what they have on, or find out what I wasn't reading, you can do so yourself. Um, so for those who have been watching my videos, thank you. I've been getting a good amount of likes, and I'm loving it. But, well, I hope you tune in again. I will try to get out another video over the next day or two. And anyways, well, bye for now. Thank you for tuning in. Hope you have a great day.